If you are having trouble opening jars, maybe some stiffness in your neck in the morning and some dry, scaly spots on your skin, believe it or not, these could all be related, and this could be psoriatic arthritis. I'm Dr. Mina. I'm a board-certified dermatologist, and I'm the host of the Skin Real podcast. Welcome to my channel where I give people real skin education and information so that they can make informed decisions about their skin health. Sound good? Let's dive in. This is my weekly recap episode where I distill out my key takeaways from my recent interview with Dr. Brittany Panico. She is a board-certified rheumatologist, and there is a ton of overlap between rheumatology and dermatology, and we're going to be breaking down some of the common and less common skin and rheum conditions that we see and treat and that you may be suffering from. If you want to check out the full episode, be sure to watch this video till the end and you can click on it. All right, so in dermatology, there's even sort of a subspecialty called rheum derm or rheumatology dermatology. And in that field, there is a lot of overlap in working together with dermatologists and rheumatologists because guess what? Your skin is a reflection of what is going on internally in your body. And a lot of times it's the first thing we see, or it's what actually brings someone into the office. You may be struggling with neck pain or having trouble opening jars or bottles, but you may just think, hey, I'm just getting older. This is just life. Yeah, my rings don't fit on my fingers anymore. That's just because I ate too much salt. I feel like we make these excuses for why we have these sort of aches and pains, but what you may not realize is that it's actually something going on internally. And I find that when people start getting a rash or redness around their eyes or their cuticles are looking ragged or they get little bumps, that is something that will make them go in and see their doctor because they can't really write that off as just, oh, I'm just getting older. And a lot of times the dermatologist may be the first person seeing you for these conditions, which is why I love dermatology. It's so much fun. Now, in my practice today, I do more procedural dermatology, but I certainly saw a ton of rheum derm in my training, in my residency with some of the top rheumatologist and dermatologist out there. And I just think it's such an amazing, intriguing field. And I know personally from my mother or watching her go through the struggles of being dismissed when she would talk about how it was hard for her to hold pans or hold things or turn knobs. And people just thought it was her age and she didn't really have any skin manifestations of psoriasis other than some thickening on her heels. But turns out she actually did have psoriatic arthritis. So I find that a lot of these autoimmune conditions, sometimes they can present in more vague ways. And a lot of times women have these conditions. And I find that, well, studies have proven this, right? That when they go to see their doctor, sometimes they're dismissed or their symptoms are minimized. And so then they don't go back or they don't get further care or further treatment. And so it's important to know that if you're having these symptoms, advocate for yourself. Some of these autoimmune symptoms are vague. They're not always a slam dunk. And if you've got some unusual skin findings, something new like little bumps over your knuckles, or you get a rash that looks like a butterfly on your face, then that's something to seek attention and find out what's going on. Now, if most of your symptoms or most of your concerns are related to the skin, then your dermatologist would be a good person to start with. But if you're having more issues with joint pain or other concerns, then your primary care doctor would probably be your first person to see, or they can refer you to a rheumatologist as well. So we definitely talked in the episode about psoriasis and psoriatic arthritis and how you don't necessarily get this classic psoriasis rash. Sometimes it may just be little pits in your nails or some thickening of the skin on your hands and feet. So it can be pretty subtle. But if you're noticing your joints are sore and you can't do your day-to-day activities, that isn't necessarily age-related and you should seek attention. Another condition we talked about is lupus. And a lot of times people hear that word and they think the systemic form and they get very worried or nervous, or maybe they had their blood drawn and they have a positive ANA, which if you're listening, you may have had a positive ANA and made you a little bit worried. But I love how Dr. Panico really just eloquently put that this is a sign to have a discussion. It doesn't mean that you have lupus. It is just a marker of inflammation in the body. And that if you have no other concerns for inflammation, no other concerns or worrisome symptoms of an autoimmune condition, then we usually don't do anything else with that. We don't make too much of it, just kind of know that it's there and maybe revisit it if things change. But systemic lupus can present with rashes on the skin. You can get what we call the butterfly mask on the face. That can be pretty common, but it can also be a less characteristic rash. It may just be some extra sun sensitivity. It may be a rash inside the ear or what looks like a scar in the ear or around the hair. So there's a wide variation, and sometimes you can get skin only lupus and sometimes you get the systemic lupus, and then sometimes you get the two together. So again, seeing a dermatologist, getting a biopsy can be really, really helpful. And certainly if you're seeing someone and they're trying to treat your rash and it just doesn't get better, then just know that that's just plan A, right? Like, don't not go back and see them and think, oh, I just have to live with this forever. No, that's when you go back, you give them the feedback. I tried this, it didn't work. And then that's when your dermatologist, rheumatologist will say, okay, now we're going to try plan B. Now we're going to try this. So sometimes with these autoimmune conditions, it's not always a slam dunk right in the beginning. So don't get discouraged. Don't give up. It's important to keep seeing your doctor and giving them that feedback so that we can get to the right diagnosis for you and the right treatments. And a lot of times that may require a skin biopsy if there's a rash that's just not responding. And this is really for any condition, right? If something's not getting better, it's not acting like it should, it's not responding like it should, then that just requires more further insight, diving deeper. Because when we're taught in medical school, all right, we're taught to not just focus on the zebras, that common things are common. And that's what we're going to start with first, unless there's signs pointing otherwise. So I love also that Dr. Panico mentioned one of her top takeaways was that if things aren't getting better, to go back, to don't give up, don't keep doctor shopping too. I find that can just delay things. Stick with someone. If you feel like you're not being listened to, then that's a different story. But it sometimes can take some trial and error and working with someone over several weeks to months to arrive at the right diagnosis. So with these autoimmune conditions, they can be vague, but just make sure you are seeing someone who's listening to you and will work with you and will be there for you until you arrive at the correct diagnosis and a good treatment plan. With these autoimmune conditions, this isn't something we can cure. So if you're listening, you have an autoimmune condition, you understand what I mean by this, right? You are seeing your doctor on a fairly regular basis. You may be having to go every couple of months for blood work. These aren't things that you take a pill a couple times and it's cured and gone forever. And so I know that can be frustrating, that can be discouraging, but fortunately there are some really powerful, wonderful, great, safe medications out there for patients struggling with these autoimmune, rheumatologic, dermatologic conditions. So just know that it can take time. Stay the course and make sure you're with someone who is committed to getting you to the right diagnosis and the right treatment. And the last tip Dr. Panico mentioned in this episode was to help us as doctors be a part of your team. In today's healthcare, even though we're so connected in so many ways with patient safety and confidentiality, it's frequently hard to share information. And so your private practice doctor may have no idea what happened at the big university or academic center that you went to. And we don't always get feedback from what happened when someone was referred to someone else. And we a lot of times want that, or we need that, especially in conditions like these autoimmune, lupus, or these other conditions. We may need to communicate with your other doctors. And so making sure that you have your medical information like in a folder that you can bring with your doctors, their phone numbers, this sort of information is so, so helpful. And even in my 40s, I'll say, oh, I'll remember that. I don't need to write that down. I'll remember it. And sure enough, I don't remember it. So especially with these conditions that can be more complex, that can involve a little more detective work and may require a more multi-specialty approach or team approach, is so important to have that information. Like today, I was just on the phone with two doctors that I had sent patients out to, and they were calling me back to give me feedback. And that was amazing. I was so grateful for them for doing that, because now I know what happened when they went away. I got the feedback on the next steps, and now I'm in the loop. And so your doctors, we want to be in the loop. If your doctor doesn't want to be in the loop, you should probably find another doctor. But help us be a part of your team by keeping all your information, your medical history, somewhere handy that you can reference, that you can give to us, and the names of your doctors, where if you don't have it all written down, I can hop on the phone and give them a call and get that pretty quickly. So I thought those are great takeaways, because autoimmune conditions, they can be complex. They can be challenging. I know they can be frustrating at times for patients, but the good news is there are amazing rheumatologists out there like Dr. Panico who are really advocating for patients. And if you are interested in hearing that full episode and seeing some of the amazing work that she is doing on social media, talking a lot about anti-inflammatory diets and natural ways to help these conditions, be sure to check out her YouTube channel and check her out on social media. And you can be sure to see the full video right here. And I will see you next week.